Hey, my people, today we'll look at insertion of an NG tube, nasogastric tube, and in my image there you can see an NG tube that has already been inserted to the stomach. So appreciate the image. Let's go to introduction. So NG insertion is a procedure in which a flexible tube is passed through the nostrils to the stomach, and it provides access to the stomach for feeding, medication, drainage, or other diagnostic purposes. Indication: it's indicated in enteric feeding, that is internal, like in patients with stroke who have dysphagia. Then gastric decompression, where we remove the accumulated gas in cases with bloating and fluid in the stomach, like in intestinal obstruction patients. Okay, also indicated in medication, in gastric aspiration to obtain samples for tests, e.g. when you want to do a test in TB patients who are still young, so in pediatrics, or you can do this gastric aspiration and you do a gene expert for TB investigation. Then in gastric lavage, found in poisoning, majorly washing out stomach contents for management. The pathway is visible: nostrils to the nasal cavity, to the nasopharynx, the oropharynx, esophagus, lower esophageal sphincter, to the stomach. Usually you can measure these things manually, or you make assumption. You just measure the tube before insertion from the nostrils to the around the ear. Then you shift to the lower sternum there, where we think the gastrium is found, and you mark that point and insert the tube. Then we have the types: feeding tubes and large bore tubes. Contraindications: it's contraindicated in facial trauma, any suspected skull fracture, esophageal obstruction, recent esophageal surgery, any bleeding disorder. Yeah, thank you guys.